Hello everybody. We're going to just briefly look at some terms for hepatitis. This may be a review, but it also may help supplement the two lectures that we're going to have. I just want to make sure you understand these basic terms. There are 5 viruses, actually 6, that cause viral hepatitis: A, B, C, D, E, and there's a new one, G, now. You may see a patient in the office, and that patient may be completely asymptomatic and have a few abnormal labs that may make you suspicious, or they may have malaise, fatigue, fever, nausea, even abdominal pain. Viruses B, C, and D can cause a chronic infection. We're going to focus here on hepatitis B terminology. So let's look at the first term. HBsAg, hepatitis B surface antigen. This is a marker for infection. It tells us that the virus is present, either an acute or chronic infection. It's often the first evidence of an acute infection. If positive, you'll know that the patient has the virus, and it also means that you can identify carriers this way also, as a carrier may have that positive hepatitis B surface antigen. If we move down to hepatitis B surface antibody, this is a marker for your immunity. It tells us that the body has responded to the virus. It usually indicates relative protection from the virus. It tells us that the patient has had the virus and recovered, or that the patient was immunized. If we go down to anti-hepatitis B core immunoglobulin M, IgM, that tells us that the patient has just had or just been infected with the virus. It rises immediately. It tells us that the infection is less than 6 months. How I remember this, and you may have been taught, is miserable, immediate, M, right after, immediate, miserable. It rises immediately. It's sometimes the only indicator that the patient has an acute infection. If we go down to IgG, you'll see that this is a marker of past infection. It tells us that the patient has had the infection in the past. The acute infection is gone. G, gone. They have the antibodies present, but the acute infection is gone. So if we move down to the core antibody, anti-HBC, this tells us that there's an antibody present to the core antigen. This can mean acute, chronic, or a resolved infection. If it's positive, it tells you that the patient has had or has hepatitis B. So if someone was immunized, they would not have a positive anti-hepatitis B core antibody. Okay, and then you see down below here this hepatitis B-E antigen, and this is an index of viral replication and infectivity. It indicates the chronic hepatitis B patients may have this. It's a predictor of chronic hepatitis B. So before we look at these examples, let's look at immunity. In antibodies, they present immunity in 2 ways: naturally and immunization. In the natural immunity, the patient actually has the infection and perhaps got better, and that's they're immune. And for immunization, you have to immunize the patient. And you can check for this protection, and usually we check this about 6 months after the immunization has been completed to see if that patient has responded. What would you do if you thought a patient was exposed? Well, you would immunize them right away, perhaps give them immunoglobulin, hepatitis B immunoglobulin, and this would only help with the acute protection. Then, however, if you suspected maybe acute hepatitis B, You might see a hepatitis B surface antigen being positive. You may see the IgM just starting to become positive, or it might not be present yet. There would not be IgG present if that was a first acute case. As far as the core antibody, remember, this is if the patient had had hepatitis B at all. It may clear and get better, and it tells you that the patient had the infection and not just immunization. So if you look at the questions at the bottom, just try these, and we will go over these in class. I just want you to take a look at them. As another example, say we had a negative core antibody, however we did have a positive hepatitis B surface antibody. This tells you that they likely had the immunization. Why? Because that core is negative. Okay, take a look at these. We'll go over these at class at some point soon, and that's it.